The hip joint is a common cause of referral to the general practitioner. Patients come in complaining of pain around the hip. The hip joint is made up of a ball and socket joint, with the top of the femur having a ball called the femoral head that sits in a socket in the pelvis called the acetabulum. Around the rim of the socket is some tissue called the acetabular labrum, and on the side of the hip, this piece of bone, the greater trochanter, which the patient can feel, has a bursa lying over it called the trochanteric bursa, with a tendon overlying this called the iliotibial band. The pathologies of the hip joint can be divided into arthritic problems, trochanteric bursitis problems, or impingement symptoms. It's important to take a history from the patient to work out what the diagnosis could be. Young patients as well as old patients can present with arthritis, and the main symptom is that of pain. It's important to ask them where the pain is. Is it in the groin, signifying it could be arthritis of the hip joint or possibly impingement? If the pain is on the outside of the hip joint, it's more likely to be trochanteric bursa. It's important to know what the chronicity or the severity of the symptoms are. If they're getting pain at night and simple painkillers aren't controlling the pain and they've got arthritis, then the patient may be a candidate for a hip replacement. Do they have locking symptoms in the hip, which is rare but can occur in impingement, most commonly felt when they're sleeping or lying in bed at night and they feel the hip catches and they cannot move it until they relax. It's also important to know the past medical history, and did they have any paediatric problems with their hip, such as developmental dysplasia of the hip, slipped upper femoral epiphysis, Perthes disease, because these can all go on to lead to problems in the future. If you now click on the exam video, and with the history and examination, you should be able to work out the diagnosis of your patients with hip pain. Thank you.